everyone. Very good afternoon to all of you. I'm Seema from beautiful Spotless Skin team, and I'm sure all of you must be doing really good. You must have come across people, especially women, with brown color patches on their face. They look like freckle, like spots forming large flat patches. This is nothing but melasma. Now, melasma is a very common chronic skin condition in India. According to a study conducted across 4 Indian cities, reveals that more than 80% of the population present skin color heterogeneity on the face, irrespective of their age and gender. Now, this heterogeneity mainly results from hyperpigmented spots and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women, 90% and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. Now, melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin conditions. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. So to avoid all these hassles and to keep you informed, today we are here to know about the management of melasma from an expert. We have with us Dr. Seema M Siddu, who is MBBS, MD, DNB, FRGUHS, and is an experienced clinical and cosmetic dermatologist, currently practicing at Dr. Seema's Skin, Hair, and Cosmetic Clinic in Ashok Nagar, Mandya, Mysore. She graduated from the prestigious Bangalore Medical College and Research Institute and completed her MD from PGIMER, Chandigarh. Dr. Siddu further specialized with a fellowship in cosmetic dermatology from QTS Bangalore, with a wealth of experience gained from working at renowned institutions like AIMS New Delhi. Dr. Seema combines clinical expertise with a keen focus on aesthetic dermatology. Her comprehensive approach to skin, hair, and cosmetic treatments, along with her commitment to personalized patient care, has earned her a trusted reputation in the field. It's such a privilege to have you with us today, Dr. Seema. Very warm welcome to you.
Thank you for the warm introduction. Good afternoon, everyone.
So, doctor, today we are going to talk about melasma, and melasma is quite a common chronic skin condition, especially in our society, in our country. We see a lot of women, especially with melasma. So, first of all, we will try to understand what is melasma, doctor.
Yeah, so basically, we have seen, especially among the general population, so many people have this pigmented skin. So it appears as patches. So this melasma is an acquired pigmentary condition. So this happens mainly in women, but around 10% of the patients do occur present with a men presentation. And also this pigmentation, this have a genetic predisposition also. It's not like it can happen 100% if your mom has it, but you have a tendency that you are carrying the genes which is making your skin sensitive for the UV radiations. So that time you have to protect your skin. Otherwise, you may develop melasma later on. So you will have a history at least that your parents, one of the parents might be having. So that time you have to start caring for your skin as early as possible. And this presents most commonly in the malar area, that is the cheekbones and also the nose. Sometimes when it is severe, it can present on the forehead and also in the cheeks.
Okay, so you have already told us what is melasma, and that in case there is a history, there is a family history, that one should start taking care at a very early stage. And the easiest way to go and consult a dermatologist, a qualified dermatologist, so that they can guide us on what to do, how to prevent melasma. Now, talking about the other causes, doctor, what are the main causes of or culprits of melasma?
So mainly this melasma is caused by these hormonal changes. So especially females are affected mainly because of the estrogen levels. So high estrogen levels are found in pregnancy time and as well as breastfeeding. And this can be the main trigger factor. Normally we see around 25 to 30 years old women, they first present with the melasma, especially during the pregnancy. And majority of them tend to respond without any treatment also, it reduces. But around rest of the 70 to 80% of the patients, they tend to carry on the pigmentation later on. So accordingly, mainly because of the estrogen levels, and also secondly, because of the sun exposure, that too UV radiations are more strongly implicated. So those who don't use sunscreens or any photo protection and expose themselves to a lot of radiations, so that's why they can develop. And other factors like some phototoxic drugs can cause it. And other factors include like too much of exposure to this hot environment, and also like those who are involved in kitchen work, like too much of humid environment also develop melasma. And otherwise, other liver disorders or thyroid disorders, because of the hormonal changes, even they can stimulate the melanin and cause melasma.
Okay, so we can say that, of course, hormones are one big reason with which we get melasma. Otherwise, hot or humid environment, sun, they can be equally harmful for our skin. The harmful rays emitted by sun, etc. Now, doctor, there are two terms. One is melasma. As laymen, we are not very familiar with this term. Otherwise, there is a term called hyperpigmentation or pigmentary disorders, which we are more, aware of as a layman. So, are they the same or are they different?
So basically, hyperpigmentation is nothing but like compared to your skin type, anything which is darker than that is the hyperpigmentation. So it's a
Okay.
broad category. So under hyperpigmentation, melasma is one of it. So melasma is caused because of the estrogen levels, as I told, mainly, and UV factor. And other causes of hyperpigmentation, like post-inflammatory, we call it, like post-acne, we see pigmentation, and post-eczema, post-psoriasis, they can form pigmentation. And sometimes post-burns, it can leave a pigmentation. These are all the post-inflammatory pigmentation categories. And sometimes we do see dark circles. It's also a type of hyperpigmentation. So hyperpigmentation is a broader category, and melasma is the most common and one of it.
Right. Initially, you said, doctor, that melasma more prominently appears on the cheek, in the butterfly, area covering the cheek,
Right.
nose. That is the most common pattern. Otherwise, also there are various other patterns in which melasma may appear, as you said. Are there other signs or symptoms of melasma? And one another very important question, as a layman, I would like to ask: do we get melasma over the night in big patches, or they start from very small spots, and then even, with time it grows?
No, melasma is not like an overnight phenomena. So initially you start seeing light brown pigmentation, especially on the cheeks or nose area. So
Mhm.
it initially develops just similar to freckles, very small brown patches. As we keep watching or observing over a period of like 2 to 3 months, it slowly the macules will start coalescing and form a bigger patch. So and also first it will be very light brown color, and over a period of like next 3 to 4 months, depending on the genetic predisposition. If it is stronger, it can progress faster. If it is like not that strong, and if the sun exposure is also not that much, it might stay the same for many years, and then later on, when any triggers are there, then it can increase. So it depends on the genetically how we are predisposed about how fast the melasma can progress. So other than the brown patches, mainly is the sun sensitivity also. Some people do complain that when they go to sun, the face becomes red, erythematous. So yeah, in that shows that your skin is sensitive, and that time you have to start the photo protection, the use of sunscreens, use of caps, umbrellas, and all earlier. So once you start using photo protection, we can prevent melasma onset, and also we can at least delay it.
Right. I think this is a very important point, that we can prevent or at least delay melasma by using sunscreens, other physical barriers, etc. Doctor, the fact remains that in our country, in India, we are still not, very used to of using sunscreen on a regular, routine basis. We only use sunscreen when we go out, step under the sun, etc. Now, post COVID, with the work from home patterns, etc., we feel that we are working from such a secure and safe, air conditioned environment. Why do we need to apply sunscreen? Why it is important to apply sunscreen on a regular, routine basis, doctor?
So basically, the sunscreen, from using the term only, we feel that it's just screening us from the sunlight. So
True.
post COVID, all of us have shifted to this digital world where we are exposed to a lot of radiations through the computers, laptops, as well as LED lights. All of these radiations will have impact on your skin. So especially for around the dark circles and also melasma, when you have a sensitive skin, all of these radiations, even though if you are indoors, you are supposed to use sunscreen. So sunscreen will have like different types. Among them, this infrared radiations and visible light protection sunscreens are also available. If you are aware of this and you start using sunscreen even indoors, then you can protect your skin over long run, not just from the melasma but overall skin health also. Because we don't know, because it's happening, sudden shift has happened post COVID, that all of us are shifting to digital use, like more.
Mhm.
Initially we used to use less this laptop and all. Now as we are doing now, the Zoom meeting also and all other classes, online classes, everything is on digital media. So we are being exposed lot and lot for blue light radiations. and especially the IT sector also. So if we are using sunscreen as early as possible, just before 30s only, we can delay the aging also. It's not, sunscreen is not just about protecting your skin, it also maintains your skin healthy, prevents antioxidant damage. So over long run, you can keep your skin healthy and young.
So we can say sunscreen also works as an anti-aging product.
Right, right.
Okay, I think that way we can, make people understand the whole importance of sunscreen more because people don't want to age. Skin is something which, makes us not realize that we are aging. So if you want to stop those, fine wrinkles or pigmentation, etc., melasma, definitely, then please start using sunscreens at an early age and start making it an integral part of your skincare regimen, skincare routine. That's really important. But Dr. Initially, you also said that humid environment, hot environment, when we are cooking inside the kitchen, such environments also triggers or works as a risk factor for melasma. Now when we are working, because most of us definitely work inside kitchens or humid conditions are there in so many parts of our country, again, do we need to use sunscreen even when we are cooking or into such environments?
Yeah, right. Because see, once you are like cooking, the heat will have infrared radiations, and especially those who are like cooks who stay inside humid environment. For them also, infrared radiations form a major part in like introducing melasma into your skin. And also, it's like even though if you are indoors, sometimes especially in summers, through windows you can feel the heat, right? So these window
Mhm.
glasses are not able to block the UV radiations. The UV rays pass through the window glass. So even when you are indoors, also as you feel the heat in the skin, similarly the face skin is, you can get triggered by this radiations. So even when you're like, for example, if any patient of melasma comes to me, first thing I advise is that once you get up in the morning, wash your face and apply the first application of sunscreen as soon as you go out of your bedroom. So this will be your first thing what you do. So this will start your skin protection of your skin from early onset, like 6 o'clock. If you're getting up, apply at 6 o'clock only, like that. So as early as possible, you start applying sunscreen, and again repeat application every 4 hourly or so, depending on your exposure.
Right. So it's important to use sunscreen, make it an integral part of your daily skincare regimen. Now, doctor, with sunscreens, there are so many excuses or complaints that people normally have. Probably that's the reason 69-70% of our population is still not using sunscreen as a routine thing, So they'll say that we don't like the stickiness that we get over our face, or it makes our skin very dull or patchy, or it makes me sweat a lot, makes my face sweat a lot. We don't like the white cast. So there are n number of excuses people normally give for not using sunscreen on a regular basis. How would you like to counter these complaints?
So basically, depending on your skin type, we can decide a sunscreen also. Meet your
Mhm.
dermatologist. Once they assess what kind of skin you have, is it a normal skin, sensitive skin, or dry skin, oily skin? Depending on your skin type, there are wide variety of the sunscreens which we can prescribe you. So once your skin is used to it, you can keep using the same sunscreens like rest of your life. You don't.
So I think due to some technical problem or network issue, we have lost our doctor for the moment. She'll join back. Till then, let me tell you, today we are talking about melasma and management of melasma. Dr. Seema is back with us. Doctor, if you can just open your camera. So very one important information that Dr. Seema was giving with the how important it is to use sunscreen on a regular basis. So if you are confused, you don't know what kind of sunscreen suits you, or why you are not getting the right sunscreen, which is made for you, please go and consult a qualified dermat. They'll help you choosing the right product as per your skin type, as per your skin related issues. So, for example, you are, you have melasma or onset of melasma, then they'll help you according to your skin type, according to your skin issues. They'll help you in choosing the right product. Welcome back, Dr. Seema.
Sorry, I
No, no,
got
it's okay.
lost
It was
in.
some, yeah, technical or network glitch, no problem. So, you were shedding light over the subject that how important it is to choose the right kind of sunscreen. You said that it's better to go to a doctor, go to a qualified dermat, they'll help you the choosing the right product. again, when we go out to buy a sunscreen in the market is flooded with sunscreens these days. As every cosmetic brand, etc. Of course, there are yeah, derma or medicated sunscreens as well. But then there are so many informations written on the bottle or on the container, the box containing the tube about the sunscreen. So, what are the basics to go for? Because there's so many information starting from SPF to boot rust star rating to PA factors, etc., etc. So, what are the basics to go for, especially in case we have a melasma history or we are at risk of having melasma?
Yeah, basically this is the problem. Like since we have lot of options, people start using randomly one which is advised by some friends or over the social media. Once they use it, they feel it is very oily, and they feel that all sunscreens are like this, and they stop using sunscreen overall. So that's why whenever you like specifically when you have a very oily skin type or a sensitive skin, it's better to consult a dermatologist. Otherwise, if you have a normal skin, what you can do is like check for SPF 50 plus sunscreens. Like above anything above 35 is fine for an Indian skin type. But when especially when you have a melasma prone skin, and also when you are working in a area where you have a lot of field exposure, you will be traveling a lot. That time it's better to go for SPF 50 sunscreen. And this PA factor you have to check. PA triple plus above 3 plus is anything is fine. And other than that, formulations you have to check. If it is a lotion base, it's going to make your skin oily. Prefer lotion for your body areas. And if it is like a cream base or gel base, cream base you can go for if it isn't this thing dry skin type, you can go for cream based sunscreens. Gel based sunscreens are very lightweight, that you can use prefer when you have an oily skin type. So formulations do matter, especially because once sunscreens is comfortable, then you feel like using it again and again. So that is very important, because sunscreen has to be a part of your skincare routine. So other than this, main thing is that application amount. So every time there is a lot of confusion. It's 2 finger length, or it's a 2 finger length or 1 finger tip. It's based on again the type of formulation which you are using. If it's a lotion based, use 2 finger lengths. And also depending on the exposure, if you are indoors, you can use like 1 finger length only, 1 finger tip, that is also more than enough. And also repeat application is what it's more important. Every 2 hourly 3 hourly we do advise, but that will be not possible practically. So at least once you are using SPF 50 plus sunscreens and also PA triple plus, they will have a long acting factors. So you can use every 4 hourly, maximum 4 to 5 hourly you can reapply. So that will be easier, so practically, and you'll be able to stick on to this regime.
Right. So choose the right sunscreen as per your skin type, as per your skin conditions. So whatever your skin type is, accordingly go for the sunscreen and make it an integral part of your skincare regimen. Don't miss on that. Again, in case of confusion, please go and consult your doctor, especially in case you have any skin issue, be it melasma, pigmentation, or acne, etc. Please go to the doctor. They'll help you choosing the right kind of product. So that's more easy. And I have actually seen people who, after finding the right kind of sunscreen as per their skin type, says that this is one product that we would like to apply on our skin, and they fall for it. So it's that good. And as Dr. Seema has already told us, sunscreen also works as an anti-aging cream. So also keep that in mind and use sunscreen
Yeah, because
regularly.
post 30, we do see people coming complaining of dull skin, and they start
Mhm.
noticing fine wrinkles. They tell, I've been using sunscreen. What sunscreen, any market product they'll be using. So if it's
Mhm.
not that effective, then you'll start seeing the dullness signs, and the skin is losing the luster, the glow,
Mm.
and the plumpiness by past 30 years. Because post 30, our skin will start, the antioxidant mechanism will start reducing post 30. So you're supposed to boost it. So if you take care of your skin after 20 to 30, between 20 to 30, if you are applying good amount of sunscreen, post 30 also your skin will be younger looking and also plump and glowy. So better
Right.
to use sunscreen as early as possible.
Right. So sunscreen is very important. The application, the amount of sunscreen that you are applying, when you are applying, reapplication, they all play a very important role. People are also confused how much time before stepping out we need to apply sunscreen. And apart, because face is something we apply sunscreen on, but we mostly ignore our neck, back of the neck, hands, ears, etc. So how important it is, doctor, to cover all the exposed parts?
Yeah, specifically, any photo exposed areas are supposed to be covered with sunscreen. Main thing is the face. Otherwise, we usually tend to avoid the neck area, but
Mhm.
skin is more sensitive than the face. So we do see like face is being like taken care of. So face skin is fine, and neck skin starts looking small, very thin, loss of luster, and then this skin shiny appearance will start coming because of the reduced depth of the skin. So that happens when the skin is being damaged a lot by sunlight radiation. So always
Mhm.
make sure that whenever you apply sunscreen, cover the areas, all areas, including ears, neck area, and V area of the neck, depending on your the dress type, and also the forearms. And we tend to apply for forearms, but we neglect the dorsum of hands, the back of the hands we neglect. So
Mhm.
this area we see a lot of photo damage because it's being neglected. So these areas, especially when you're wearing this sari, make sure you apply sunscreen for the back of the back also, back of the neck, and the upper back also. So that will help in like complete overall sun protection for your body.
And it will give you an even tone. That is also important. Otherwise, yeah, look wise, it's not that pleasing. Now, so sunscreen is very important. Sunscreen is one thing which can prevent or at least prolong melasma. Apart from sunscreen, as doctor said, physical barriers like hats, scarf, cotton scarf, sunglasses, umbrellas, they also work and are helpful. But apart from that, doctor, a very common tendency we see in our country, whenever we see any, skin related issue, we run inside our kitchen and start applying things, home remedies. We are really obsessed with it. Now, for melasma or pigmentary disorders, also, we are so obsessed. We'll apply, starting from papaya juice to potato juice to lemon. I've seen people applying lemon juice, lime juice on their face. And only when they see that it's not working or it's, going the other way, that's when they go and land up in front of a doctor. Or
Right.
else we have these chemist shops easily accessible, available. We'll go there, ask for any over-the-counter, application. Ki we are getting these spots or freckles. Please give us something. Again, we fall for the tube because initially they work wonderfully. Only later on we realizes that now we are an addict. So, how important it is to not fall for these home remedies or these over-the-counter topical applications, especially in case we have melasma.
Yeah. So firstly, the homemade remedies, as you told, see, we have a concept like overall, all humans have the concept that anything natural is safe. So
Mm-hmm.
it's not true. So for example, when you say take a lemon, so lemon is having citric acid. So when you apply on any kind of skin, if it is like sensitive or if you have melasma is basically a skin sensitive skin disease. So when you apply anything to melasma, it can either go improve or it can get worsened. Melasma, we do call it as double-edged sword. Even when we're treating, we think a lot before prescribing something because skin can react in both ways. So we have to prescribe accordingly for each and every patient. It will be a personalized skin care. And in that cases, when you apply something like citric acid or like lemon or potato or tomato, the acidic content in the fruits or the lemon vegetables, it can trigger your skin and in fact damage the skin further, make it more sensitive. So after that, if you come to a dermatologist, we'll not have a lot of options to prescribe because the skin is already sensitive. So we can't give you any stronger creams which will help you faster. So what we have to do is repair your skin, bring it back to normal, then take on the pigmentation part, and then later on carry it out. So it will actually prolong your treatment course also. So if it is just a normal tanning and all, you can give it a try, not a harm. But if you have a sensitive skin, if you have a dry skin, or you have a melasma or any photo aggravated skin disorders, please don't try any home remedies. And second thing, as you told, it's very important. Like in South India, almost I have seen, like I have worked in many places. It's all almost as natural that once they start seeing the pigmentation, they go to the medicals, they take any over-the-counter medications, and they start using it. So one thing is that it will give immediate result. So they'll not understand that anything which is giving immediate result is not safe. So people want fast results, and these creams do that. But you have to keep it in mind that this faster improving creams have a steroidal component. Even though we doctors, we see allergy or eczema on the face, we hardly prescribe steroids, and it will be for a short duration, like less than one week to 15 days max. So in that cases, if you are using the steroid combination creams for longer period, like some people do come after like 1 year, 2 year or so, you'll start noticing that initially your face was glowing, but later on you'll see that pimple breakouts are coming up, fine hair starts growing, and especially when you go in front of the kitchen stove or in front of in sunlight, the face becomes more red or mild itching and burning sensation, everything will start. So this is caused because of this topical steroid is damaging your skin. So this you will understand later on. So please make sure that any cream before applying to your face, See, face is the exposed areas, so this will have to carry on for the rest of your life. So before applying any creams on your face specifically, make sure that you know about the contents of it, and at least take an advice from a medical expert if is it safe for using it, and especially over long run. So steroid combination creams are easily available. That is the problem. And also, since it's giving faster results, make sure that it's not used for longer time. And also, whenever you're using that, some people do tell that once, if for example, I have got an improvement, I'll tell my friends also, see, I have got
Right.
improvement, please use it.
Very common.
That is also happening. So when I tell one single patient that please don't use it, please stop it, then she'll like, I have told many of my friends also. Then I have to tell them to convey the same message to their friends also, please stop using, because later on, once they come after that late stage, at least after 1 year or 2 years, it will be so difficult to treat, because sometimes we can't bring back the skin back to normal healthy also if it's too much damaged. So please identify such creams if you have, and please stop using it as early, and meet a nearby dermatologist. They can educate you in that aspects.
Right. We need individualistic approach in treating the problem, and for that, you need stop, following what your friends or family members have used and they liked it. It worked for them, but it's not sure that it will also work for you. Again, in case you want to save your money, save your time, save your energy, and most importantly, save your skin, save your health, please go to a nearby a qualified dermatologist. Don't fall for quackery. Don't fall for over the counter medication. Don't fall for what the various influencers on various social media platforms are asking you to do. Don't go for these DIYs and home remedies. Go to the correct person, which is a qualified dermatologist. And that way you'll, save your money, energy, your skin, everything. So please go to the right person. That's really important. But doctor, when a person comes to you with melasma, are there any tests that you normally recommend, or just by clinical investigation, etc., you start or decide the line of treatment?
So basically, for diagnosis, like clinical examination is more than enough. But we do a magnified imaging called a dermoscopic imaging in our clinic. So with that, we can identify which type of melasma is it. Is it very superficial, like only limited to the first layer of skin, the epidermis, or if it's deeper, or if it's a mixed variety. So the use of identifying this different types of melasma is that we get to know the prognosis, how they'll respond. Epidermal melasmas do respond faster to treatment, and with just topicals, they'll tend to have a very good response. For those with mixed and dermal melasmas, we need a longer treatment, and also sometimes oral medications and procedures also we advise. So another dermoscopic examination is an advantage if you meet a dermatologist.
Hmm. Right. And what are the treatment options available?
Treatment options, again, it's based on your type of melasma. We decide if it's a very new onset and you have not tried anything, so skin is naive, so we can give a first line treatment of topical creams which will reduce the pigmentation, and you will get faster response also. Sometimes people do come with us with a very thicker pigmentation, and it has been there from long duration, and you have tried multiple medications. We have to that time treat aggressively to, because once the melasma is standing on your skin for longer time, it will start going deeper and deeper. So once the deeper layers are affected, we'll have to do multimodal approach. We have to use topical creams also, oral medications also, and sometimes we do combine peels, lasers. So all of this multimodal approach will give you in improvement, help you in improvement of the melasma. And some people like once they have used topical steroidal creams, it is a different topic as such. So in that time, we'll have to treat basically the sensitive skin. We have to reduce the side effects of the topical steroid cream, and then once the skin is normal, which will take at least 3-4 months, then we start the melasma treatment. So depending on your skin type and the heredity also, sometimes we do see male patients coming up with the melasma, because out of 100, at least only 10% around males have the melasma, because mainly it's contributed by female hormones. In males, it's basically because they're genetically prone, like mothers or sisters will have it, and they are used to working in hot environments. That time they tend to develop it. So for males, we tend to they're little difficult to treat. That time we tend to advise oral medications and procedures in the initial phase only.
Okay, doctor. Now, doctor, because we are talking about melasma, a very common question people often ask is that, especially because, as you also said, during pregnancy, ladies do get melasma. Many of them do. Sometimes it fades away after postpartum. Otherwise, it stays. As we all know that during pregnancy, over-the-counter medication are a big no-no. What kind of treatment you normally suggest, and what would you like to tell to all the women who are watching this session related to melasma during pregnancy?
Yeah. So especially if you are pregnant or right now breastfeeding, main thing which you can do is just apply sunscreen. Because anything which you apply creams, you'll be concerned that will it go to my baby as a fetus
Mm.
in utero, or if it's my baby will touch my skin, or if something will happen. So even though we have safer creams, I usually don't treat till they are like very much worried. Because I give an option that once you stop breastfeeding, it will tend to fade away. We'll wait and see. If it is not fading off, then we can start using the creams. If they are very concerned that they want to start treatment now only, we can start topical creams only, no procedures or no oral medications we advise. And
Mm.
main thing is that sunscreens, even when they are indoor, especially we know that even like postpartum people tend to stay inside only. That time, even though like they are not exposed to sun, we advise sunscreen, because sunscreen is one thing is safer. And again, as I told, from the infrared radiations from the kitchen stove, from the ultraviolet radiation from the window panes, so we can at least protect our skin and prevent further exacerbation of the pigmentation.
Right. Doctor, when we go out for, beach vacation, we all carry a sunscreen with us. But when we are going for mountaineering or to any hill vacation place or trek, we normally don't keep a sunscreen, feeling that we are going uphill. The weather is going to be pleasant and it's going to be snow. So we normally don't keep, or it's not in our practice. But then we see a lot of people who stays at higher altitudes with pigmentary issues. So why, or is it really important to carry a sunscreen when we go uphill?
Yeah, it doesn't depend on if you're going for the lower altitude or higher altitude places, radiations will always be there. For example, if you're staying at your home also, when it is cloudy, some people moving in and around the house, if you feel that it's cloudy anyway, why do I need
Mm.
sunscreen? The clouds will not block the UV radiations. Similarly, when you're going high altitude also, the UV radiations will be there. So, like many people do complain that I had gone for trekking and then I came back with tanning. And other than that, we do have examples that people staying there will have melasma because they are more prone there. Like Himachal Pradesh area and all, we have seen people developing melasma more sooner. So that is because the it doesn't depend on the altitude. So we have to use sunscreen even on a hot sunny day, also on a cloudy winter day. Also, you are supposed to use sunscreen.
Mhm. A very common question people often ask, especially those who are going through the treatment, that is melasma going to permanently cure or I'm going to live with it? So normally, how long it takes to heal, and how much? I mean, how much controlling of these spots, freckles is possible?
So basically, instead of the cure term, what we can use in the case of melasma is that we can like whatever appearing on the skin, we can like remove it completely, but it will be there inside your skin. Inside the skin means the skin is carrying some genes which will make it prone for the sunlight. So once you are like you have completed your treatment course, your skin is all fair, all the patches are gone. But again, if you go under the sunlight can trigger the genes inside your skin and stimulate the melasma again. So post your treatment also, you're supposed to take precautions. Sun protection measures has to be taken. So it is not something which can be cured. Cure term we use for like anything external cause. Like for example, you have acquired an infection, we can cure and remove it out of your body. Melasma, psoriasis, all these conditions are forming from inside your body. So we can't remove it from your body. This is inside your genes. So we have to carry on the maintenance measures also. And also again for epidermal melasma, as I told, which are very light brown patches and also of short duration, initially 4 to 6 months of treatment, they'll respond faster. And after that, we shift to maintenance therapy of just sunscreens usage. Again, if you have a longer duration of melasma, if you have mixed type or dermal type of melasma, you will need a longer course, maybe a year or so. And again, post controlling also. Sometimes for the long-standing cases, we can't achieve 100% repigmentation also. Sorry, hyperpigmentation also. That time, we can achieve around 70 to 80% of reduction. Post that, will maintain with the lower and safer creams as a nitrogen along with the sunscreens.
Okay. We have one viewer with us, Yash Namdev. His question is, what all symptoms I can get? Uh, I have a brown skin. So is brown skin more prone to having pigmentary issues or melasma, doctor?
Yeah, darker skin type people will have a more number of this melanosomes. We call as pigment cells. Inside that we have pigment globules that is more in darker skin type. So we tend to see that whenever they have a little trauma, like small fraction, friction also, or when they pop up pimples also, they have a darker tendency to leave dark spots. So that is there in case of like South Indian skin type, which we do see.
Mm. And as you said, family history plays a big role. So, in case there is a family history, how early we need to start, at least with the sunscreen and taking good care of our skin?
You can start using sunscreen even in childhood also, but at least when once you're 18 plus, you start using, especially if you have like mom or sisters having melasma, then or grandmother having melasma, you can start using sunscreen as early as possible. There is no age restrictions like you have to start post 20 or post 25 only like that. After like 12 years also, for kids also we use sunscreen, especially if they have photosensitive disorders, or if they're going under this playing under sun a lot, we can start using sunscreen as early as possible.
Okay. Doctor, one more thing is there. We always say a good skincare regimen is what we need. Of course, sunscreen is an important integral part of that. But what other very basic minimalistic skincare, regimen, how can we keep it and have a healthy skin?
Just as a routine skincare, main thing what you have to stick on is to a milder cleanser. It's either it's a face wash or a cleanser or a soap. Let it be mild. It should not be harsh that it once you wash your face, it's making your skin tight and hard or rough when you touch it. It should be smooth, and it should not make it like very thin. So over long term, you sometimes the stronger face washes will make your skin rough and thin. So that should not happen. And post face wash, make sure you apply moisturizer first, both morning ones and night ones. And face wash also just twice daily is more than enough. Post face wash, immediate application of moisturizer and gently massage it so that it will improve the hydration of your skin. Over that, in the morning, you can top up with the sunscreen. And especially some people do have a habit of using scrubs. Don't over exfoliate your skin. Like hardly maximum weekly once or twice is more than enough. Once if you have a dry skin, and twice if you have oily skin, not more than that. If you have sensitive skin, it's better to avoid scrubs. Other than sunscreen, moisturizer, if you have any like active uh, uh, diseases in your skin, then we can give active ingredients. Otherwise, just this much is enough for a routine skincare.
Fair enough. There's one more question by a viewer. Can melasma turns into cancer?
No. Melasma won't turn to cancer. So basically, cancer is something where the number of cells will start growing out of proportion to the normal. And melasma, no such thing like happens. Only that in melasma, the number of pigment cells increase and the pigment production is increasing. And that too because of the hormonal stimulation. So hormonal stimulation won't be that stronger that it will cause cancer in the skin. And cancer producing cells, the that's called as melanoma. It's not melasma. So that's why this, since the term is similar, we might get confused. It's a different term. So melasma, we don't see any cancerous growth in that.
And Dr. Seema, before we sum up the whole session, any take-home message for our viewers?
Yeah. So basically, main thing is that even if you have melasma or not, even if you have any field exposure or not, even if you are staying indoors, if you are doing laptop work, so make sure that you are using sunscreen, and start using photoprotective measures, especially in summers. Like when you go out, additional photoprotective measures also. As early as possible, if you start using sunscreen, the skin will be more healthy. We can prevent much more other diseases by routine use of sunscreen. And sunscreen don't restrict to face usage only. Use for face, neck, hands, back, which all the exposed areas are there.
Right.
And especially another thing is that once you have a melasma, make sure that you don't use OTC products, over the counter products. Make sure you meet a like qualified dermatologist and get a treatment as early as possible, because once you come and visit us as early, we can also give the results faster. If it's they stayed in your skin for longer time, it will be more difficult to treat because it goes deeper and deeper inside your skin.
Absolutely. Thank you so very much, Dr. Seema, for joining us for this session, taking out your valuable time, and for this very informative session. Thank you so very much.
Thank you.
And viewers, thank you for your active participation in today's session. Stay happy, stay healthy, and stay connected to our beautiful Spotless Skin page. Have a great day ahead. Goodbye.